We've discussed what to do at the doctor's office, but what about when we're back home, where most of our lives are lived? After your doctor's visit, it's important that you understand what your doctor has told you and that you feel comfortable and confident following the advice or instructions that you received. After your visit, call the doctor's office and ask to talk to a nurse or your provider if any of the following things happen. You have problems following the doctor's advice, you have questions, your symptoms get worse, you have questions regarding when or how to take your medication, you have problems with the medicines themselves, you have had tests done and don't hear back from your doctor about the results. Be sure to write down the answers you get or have someone else write them down. And please, we encourage you to feel comfortable and confident reaching out for this information that you need. Next up, how do you prepare for emergencies at home? As a partner in managing your own health, you need to be ready in case of a medical emergency. This is especially important if you're dealing with a disease or condition like chronic pain that could potentially cause an emergency. To be ready for a medical emergency, make a list of the following important telephone numbers here on the screen and put it where you and others can find it easily, including numbers for your doctor, an ambulance, a 24-hour pharmacy closest to you, your electrical company, and numbers for close family and friends that are part of your support network where a medical emergency is supposed to happen. This isn't supposed to scare you. It's a reminder that preparing for an emergency will help you remain calm and collected should anything come up in the future. Finally, we're going to discuss medication. Another important way you can participate in your healthcare is to keep up with your medical appointments and effectively manage your medications and take them as prescribed. Sometimes you may hear your medical team talk about medication compliance or adherence. Medication compliance and adherence really means two things. One, taking the correct amount of the prescribed medication or the correct dosage, and two, taking medication at the correct times. This sounds simple, but many people have a hard time taking their medication as prescribed. Can you think of times in your life when you've struggled to take medications as instructed? Taking medications as prescribed is critical because the body processes different types of medications in different ways. Some medications act on the body very quickly, and others take time to build up in our system. Regardless, if your body doesn't get the right amount or dose of the medication, it's a problem. Getting too much of a medication can damage organs in your body responsible for processing toxins, like the liver and kidneys. This is why so many medications, like over-the-counter pain relievers, include warnings not to exceed a certain dose in a given time frame. On the other hand, not taking enough of a medication or taking it at the wrong time can be dangerous. For example, certain medications such as blood thinners must be taken at just the right time to be the most effective. Quitting a medication because you don't feel like it's working or because you feel better is dangerous. Our bodies become used to receiving medications we take regularly, and when we abruptly stop, we can experience withdrawal symptoms. This is especially true with medications to help with our mood, like psychiatric medications. Withdrawal symptoms can be both uncomfortable and dangerous. On the other hand, with drugs like antibiotics, not taking the full course can result in a drug-resistant bacteria, where the infection in your body evolves to evade the medicine you're taking. This is a problem for you and the whole community. Chances are you aren't surprised by the information we discussed. Most people are aware of the consequences of not taking medications as prescribed, but the reality is that most people also have trouble taking their medication as prescribed at one time or another. In general, what are some reasons why people might not take their medicines as advised by their doctors? Pause the video and discuss or reflect. Some reasons why people might not take their medicines as advised include people don't know what their medicine is supposed to do. They're not sure of how to take their medicines. They can't afford their medicines, and so they don't get them. To save money, they take their medicine every other day or cut pills in half. They're taking other medicines and they don't want any new ones. They don't feel well and they don't think the medicine is helping. They feel medicine is giving them side effects they don't like. They may forget, or they may think they can do without their medicines. Or they don't have anyone to help or support them in taking medicines. Think about your own experience. Do any of these reasons apply to you? If you've had trouble taking your medication as prescribed, what got in your way? Pause the video to reflect or discuss. There are strategies to make sure you're taking your medication as prescribed as frequently as possible. These are a simple list of do's and don'ts of medication. These tips help us keep track of how we should be taking medications and what strategies can be helpful for us. Number 1, don't stop. Medicines work best when taken as advised by the doctor. Skipping a dose or stopping your medicine can be harmful. Don't stop your medicines unless you're instructed by the doctor to stop. Do call and consult if you have any questions, as discussed previously. Don't over-medicate. It won't help you to take more than what is prescribed. This can be as harmful as not taking a medication at all to your organs that process toxins from medication. But if you're not feeling well, reach out. Don't run out. Keep your prescriptions filled at all times. This may involve coordinating with family and friends to make sure you have access to your medication, or thinking through ways that you can financially make it possible to get your medication. Which means you need to tell your doctor if you can't afford your medication. Medications are certainly so costly at some times. If the cost of your medicine is a problem, this is something you need to be honest with your medical provider. The doctor might be able to prescribe other medicines for you that cost less. Many medicines, as you're probably familiar, have a generic form that costs less than the brand name form. You can also compare prices at different pharmacies or buy medicines from mail order pharmacies. Maybe you could ask a trusted friend or family member to help you think about these options. You can also ask to see a social worker while at the hospital or a health clinic, or have a doctor contact a social worker in your community. The social worker will know about programs that can help you pay for your medicine if you qualify. A staff member may be able to help you fill out forms for low-cost or free medicine from drug companies or through the Medicare Prescription Drug Card program. Tell the doctor what you're taking. Tell your doctor about all other medicines you are taking, including pills and remedies that are over-the-counter or herbal remedies. Examples are aspirin and laxatives. Taking over-the-counters can change the way your prescription medicine works, so keep your doctor in the loop. And also talk with your pharmacist. Your pharmacist can help you think about the best medication plan for you. For example, some diabetes medicines cause an upset stomach, and some blood pressure medicines can cause leg cramps or cold hands and feet. Your pharmacist can help you with these issues. And tell your doctor and pharmacist about any side effects that you experience. Read your labels. Your medicines come with warnings, so be sure you understand what your medication bottle says. And ask about labs. Ask your doctor or your pharmacist to let you know if you need laboratory tests from time to check how your medicines are working. Finally, let's review some tips for remembering to take your medications. This is something you may have some experience with, but some suggestions that we have are to take your medication at the same day, use special boxes that help you organize when to take your pills, create a support network of people who can remind you when to take your medication, keep a medicine calendar, or put a sticker or reminder note on your refrigerator. Take a moment to reflect as we wrap up this video on your strategies for making sure you take medication as prescribed, and also strategies for remembering to simply take your medication on a daily basis. Thank you for participating in Session 7. You deserve quality health care for your chronic pain, your mood, and anything else that comes up for you in your health journey. We are here to support you and discuss strategies to better manage your health care. Thank you.